Our topic really tonight is about the currently unequal distribution to the knowledge that is meant to be driving this new economy, the access to it. And I guess our questions, if we can define it, is how can access to knowledge be made more inclusive rather than less, which sometimes feels the case, and maybe more ambitiously, if we have time, if we get that right, what kind of reformed or improved society could be built if we make that work.
In the age of mass production, people were almost an extension of machine, right? So the machines do some things and there's people there to operate them. Whereas in the most advanced firms now, actually people and machines have very different roles. Machines can do everything that can be automated or routinized, but we rely on people for the one thing they can do that machines definitely can't do, which is to imagine stuff. So the problem is, though, that unlike the era of mass production, which did spread to all parts of the economy and pretty much in all parts of the world, these advanced practices of innovation haven't spread. Instead, we see concentrations in a few places and among a few firms.
First of all, we have to deconstruct what this knowledge, what do we mean by knowledge, and who owns it, and how it's who defines what knowledge is and who needs it where.
Importantly, the trend is towards greater concentration. So we're not becoming more equal, we're becoming more concentrated, and within firms and sectors we're seeing increasing monopolisation.
Welfare state, welfare, the very idea of it has been seen as a burden. It was never created, it was never intended to be a burden. We're living in a city where the first poverty line was designed, right? William Booth. It wasn't seen as a burden, it was seen as a positive presumption of increased understanding of what it means to be human.
I think that three things that are really important are around the cultivation, the ownership and access to knowledge. So much of government investment in research and innovation goes on creation of knowledge, like R&D, not on spreading it. And I think there's a huge amount we could do to think about how to give a much wider range of people access to these advanced production practices.
People at the sharp and inverse care law who deserve to define knowledge and access, and the institutions that, frankly, no matter how well-intentioned they are closed to those people, closed in very hard and fast ways. What does that tell us about the welfare state? By which I mean the means by which we maintain people at a decent level of income. That's one aspect of it, right? It tells us that it will fail if it's not co-produced with the people who are meant to benefit from it. That a deliberate attempt to create or recreate what a library should be in a community depends on the collaboration of that community across public, private and not-for-profit in the interests of the users. But the algorithm, if anything, should work. It should give you more time with your doctor, not less. It should give you more of an experience and a relationship with your health, not less. But that should be the same for everybody. Movements are the new institutions, but we have to understand them as they are movements, which requires a different kind of leadership.